Yeah, Dr. Anjalakshi has joined. Hello.
Hello. No, ma'am, not yet.
Yeah. She said she didn't know that there is a separate link for panelists.
Okay. Okay, ma'am. I'm checking in the attendee list.
Yes.
No, ma'am, she is not here yet. I cannot find.
You have Dr. Suresh slide with you.
Is she there?
And now is it fine? Danya?
Yes, ma'am. Ma'am has joined. I have made her the co-host.
Just ask her to check share screening. Only 1 minute more.
Yes. Yes, Anjalakshi, ma'am, if you can please check your screen share if it is working or not. Ma'am, can you hear us?
Shall we start? It is 4 o'clock.
Yes, ma'am, we can start.
Please start. Yes.
Yeah.
So, Dr. Anjalakshi, you can start. Please keep your video on.
Yes, ma'am. Shall I start, ma'am?
Yeah, please start. We are already 1 minute late.
Okay, I'm sorry, ma'am. Video is not opening, ma'am, because host was closed for that is written.
No problem, no problem. You
Okay,
project the
ma'am.
slide and start the session. Yes,
Okay.
yes.
Okay, ma'am. Happy evening to all. I welcome our chairperson, Dr. Lada Venkatesan, President, CNRS North Zone, Professor cum Principal, College of Nursing, AIMS, New Delhi. Welcome, ma'am. I welcome our Organizing Secretary, Dr. Muthu Venkatachalam S, Chairperson, Research Committee, CNRS North Zone, Assistant Professor, IHPAS, New Delhi. Welcome you, sir. I welcome our eminent speaker, Dr. Suresh K. Sharma, sir, Professor cum Principal, College of Nursing, Jodhpur. Welcome you, sir. I welcome our all participants from various of college and various of departments, speakers, delegates, members of CNRS, North Zone, and B.Sc MSc students from various of colleges of today's sessions. I welcome you all once again. Is it visible, ma'am? Is it visible, everybody?
Visible, visible.
Yes, ma'am. So now I'm going to introduce our eminent speakers today's sessions. Clinical Nursing Research Society organizing North Zone online short-term courses in research methodology. So today's speaker, Dr. Suresh K. Sharma, Professor cum Principal, College of Nursing, AIMS, Jodhpur, Rajasthan, India. Sir's professional background, Dr. Suresh K. Sharma received Master in Medical Surgical Nursing at Postgraduate Institute of Medical Education Research, Chandigarh in 2005 May. He completed PhD in Administration with the specializations in Patient Satisfaction with Nursing Care at Punjab University, Chandigarh in the year of 2010 January. He was scholar at Global Nursing Leadership Institute, Geneva, Switzerland in August 2022, September 2021. He obtained postdoctoral fellowship of Nursing Research Society of India in 2017. I think it's gone.
What happened, Anjalakshi?
PPT is gone, ma'am.
You were only sharing, no?
No, ma'am, I given, sir told Muthu sir, you can give to them, they will share you. They only share us.
You can share.
Okay, ma'am,
Yeah.
okay.
Tanya, you can share yourself. You are the co-host now, please.
Okay. Sorry for the disturbance. And sir had hospital management and leadership at National University of Hospital, Singapore in 2020 September, and postdoctoral fellowship at University of California, US, September 2011 to 2012 August. He has more than 20 years of experience as a nursing profession, as a nurse academician, researchers, a leader, etc. While working as a lecturer, reader, and professor of nursing at Dayanand Medical College and Hospital, Ludhiana, from June 2005 to March 2013. He worked as a professor, principal, and dean, College of Nursing at AIIMS, Jodhpur, Rajasthan, with effects from December 2022 till date. He was also visiting professor at Sri Ramachandra Institute of Higher Education Research in Chennai from December 2020 to December 2022. Besides being is an examiner of undergraduate and postgraduate and PhD examiner at several universities and institutions in India as well as abroad, he served as a postgraduate and doctoral nursing examiner at Sultan Qubas University at Muscat, Oman, and University of Brunei and Darussalam, Brunei. And sir, having professional achievement, he is a prolific writer, author for 6 books, and editor for 5 textbooks, contributed more than 175 research papers in Index Journal with more than 1,000 citations and Hatch Index 15 papers. He also served as an editor and member of editorial team in national and international journal of repute, including Journal of Caring Science and Journal of Medical Evidence, etc. He is a director and international network of doctoral education in nursing, US, and he is a founder president, Society of Peri-Operative Nursing, India, as well as Society for Critical Care Nursing in India. He served as a board member in International Federation's Pre-Operative Nurses. He has been conferred with many prestigious awards, including one Florence Nightingale Award in 2001. His area of interest, research or area of education's critical care nursing and metabolic disorder. I welcome you, sir, for today's sessions. And today's sessions is formulating research objectives, hypotheses, and assumptions. Platform is Zoom and YouTube online CNRS, and timing 4 to 6. I request all the participants be silent for your mobiles, and you can chat all the questions on the chat box. And after sessions, we will be clarify one by one for each questions by the eminent persons. Over to you, sir.
Thank you so much.
Yeah. So can I speak for 1 minute? Dr. Suresh, on behalf of CNRS North Zone, once again, we extend a warm welcome to you and thanks for accepting our invitation. It was very short notice, but when I called immediately, you have accepted the invitation. And for the knowledge of the participants, he has written a textbook on nursing research and biostatistics, which is one of the textbook widely used by postgraduate nursing students in India. And that book, he has given a lot of live examples from his personal experience. So all of you, please have a look at his textbook. And it is a good book which can be recommended for the postgraduate nursing students. And actually, all are waiting to hear your session, Dr. Suresh. So thank you so much for accepting the invitation, and over to you.
Thank you so much, madam. At outset, I would like to express my heartfelt thanks to CNRS North Zone, specifically President Dr. Lata Venkatesan, who is Principal at College of Nursing, AIIMS, New Delhi, an entire team of CNRS. I'm grateful that I'm here with the young mind today. Just give me a moment to share my slides and then I'll speak about my assigned topic. Hope you can see my slides.
Yes, sir.
Yes, it is visible. Yes.
Perfect. Thank you so much. So I'll be speaking for next 1 hour about formulating research objectives, hypotheses, and assumptions. Before I speak about research objectives or hypotheses or assumptions, I would like to mention that research problem on which you had a talk yesterday by Dr. Lata are interconnected. The research problem gives birth to research objectives. Because research problem remains a general statement, to have a focus, we formulate research objectives. And from research objectives, we link and we align research hypotheses and assumptions, which gives a further focus to our research, what population, what sample, what data we will collect, and what we will analyze and what we will ultimately interpret and conclude. Now, before going to topic per se, I would like to remind you back about variables. In research, anything which varies is called as variable, and we can only conduct a research if a component varies. That is called as variable. And these are the terms which we commonly used: independent variable, dependent variable, research variable, externus variable, and demographic variable. Just to remind you back. One more thing I want to remind you about: operational definition, vision with conceptual definition. I have seen with my experience that in thesis we encounter conceptual definitions. However, you should use operational definitions. And how they differ, we can understand with this example. Conceptual definition is a precisely a definition which indicates the fundamental characteristics of a concept. For example, here constipation is defined as a passage of hard stool, infrequent stool, and the need of excessive staining, a sense of incomplete bowel evacuation, and excessive time spent on the toilet or unnecessary, unsuccessful defecation. Now, with this is all which completely defines conceptually to this particular concept, that is constipation. But it may be different, the time spent on toilet for different people. So this is more of conceptual component of this concept. But when we do research, we require something which is very objective, constipation. Constipation, in one researcher can say bowel movement less than 3 times in a week, he can call them constipation. Straining duration greater than 25% of bowel movements in last 12 weeks, or a lumpy or hard stool greater than 25% of bowel movements in last 3 weeks, or a child who has pebble-like or hard stool for majority of the bowel movements for last 2 weeks, or a firm stool that is greater than or less, greater or equal to the 2 times per week or at least 2 weeks, or maybe combination of these characteristics make your operational definition. So one suggestion here is, in research, when you define your concepts, use operational definition, not the conceptual definition, because conceptual definitions are abstract in nature and they become very difficult to observe and measure, where operational definition gives you clear-cut idea how to observe and how to measure this particular concept. Now let us understand about research objectives. You all have seen, you formulate a research question or a research title or research problem, and then thereafter you formulate research objectives. So what they are? These research objectives are clear, concise, declarative statement which provide direction to investigation, particular variables or concepts which you have undertaken in your study. Generally, research objectives focus on the way to measure the variables, such as you can identify something, you can describe something, you can compare something, you can examine something, you can check, assess the efficacy of something. So this is how you focus your work through the objectives. Sometimes objectives are directed towards identifying a relationship or difference between two or more variables. Now, what is the need of objectives when we have a statement? Yes, objectives are needed to focus your research, that you are only going to assess this. Let us give an example. If you are going to study something on HIV and AIDS, you can only just assess the knowledge of the people about HIV and AIDS. You may assess their belief system. You may assess effect of one educational intervention on their knowledge. So you may have a wide spectrum of studying one particular phenomenon, but to focus it, you are only going to assess the knowledge. So through objectives, you focus it, that you in your study, you are only going to assess this component, or you're going to identify this component. This also helps you to give it directions. What kind of population you will include, how much sample you will include, because your sample size will be determined by your primary objective. And it will also give you idea what data you will be collecting, how you will collecting your data, and what you will analyzing, and what the conclusion you will be drawing. It also helps you to, avoid the distraction, because when you are entering into a research setting, if you have your objectives, you will not collect unnecessary data, because everything costs the time, money, and resources. So you have to be very precise when you are going in a path of research. The last but not least is you be organized when you have your objectives. Now, what are the characteristics of good objectives? Good research objectives are smart. They are specific to your problem. They are measurable. That's why I have, in my second slide, I have talked about operational definition. Through operational definition, the term or variables which you are using in your objectives, you precisely state them in a measurable term, and they are attainable. I gave you a conceptual definition where it is not attainable or it is not measurable. And sometimes your objectives are such vague that it's difficult, they are not realistic. And they must be time bound, that within the time frame you can achieve them. In your undergraduate program, you may have a time frame of only 1 month or 15 days, or maybe less than 2 months. In postgraduate, you may have 1 year or 9 months of period. In doctoral time, you may have 2.5 years of time for active research. So based on that, your objectives could be. The other characteristics for theoretical purposes, they must be specific, measurable, attainable, realistic, and time bound, but they also could be relevant, feasible, they could be logical, observable, and unequivocal. Now, how to state these objectives? When you state these objectives, remember, objectives should be presented briefly and concisely. They should not be written in paragraph. They has to be as precise as possible. Objectives must be in concurrence with research problem. You cannot have objectives away from your research statement. If your research statement says that is you have a descriptive or cross-sectional study, on knowledge and belief of about HIV and AIDS of nursing students studying in particular institution or region, then your objectives could not be away from knowledge and awareness, knowledge and perception. You cannot have other objectives in this. So it has to be, the objectives should be very well married with the statement of your problem or research question, and must be stated in coherent way or in a logical sequence. If your study is assessing first knowledge and then it is assessing perception, or it may be going all together, or maybe a testing a particular educational intervention. So you are assessing pre knowledge and then intervention, and then the post intervention knowledge. So it has to be stated in a logical manner. The objectives are clearly phrased in operational term. That's the reason, like in my second slide, I've talked about what is operational term. So your statement of objective must into operational terms so that you can clearly know how you are going to measure them, and exactly what researcher is going to do and where and for what purpose you are going to use these objectives. They must be realistic considering the local conditions. I'll be explaining this into local condition when I'll be speaking the subsequent slides. And you must remember, you use action verbs for those specific objectives. Those can be evaluated. Sometimes I have seen people use to study, but to study is not an action verb. What are the action verbs? These are the common action verbs you can see for quantitative methods or quantitative research. If you are doing a descriptive study or a cross-sectional study, you may use these action verbs to identify, to assess, to find out, to describe, to compare, to contrast. If you are doing a correlational study, that is cohort and case control studies, you can use to determine, to examine, to identify, to discriminate, to compare. And if you're doing an experimental study, you can say you examine, determine, investigate, measure, detect. And maybe sometimes interchangeably you can use this. But these action verbs should be used when you state your objective. I'll give you examples how to state them. In qualitative research, if you're doing ethnography, you can use these XML for an example: assess, describe, examine, explain, discover, and drive. Grounded theory, where you develop micro theory, you can use develop, extend, identify, validate. And if you're having a phenomenological study, for example, you can use describe, develop, generate, record, and express. So these are the examples of action verbs, and you may use them, as I said, or maybe sometimes interchangeably. That hardly matters. But use action verb when you state your variables. Now, what are the types of variables? The types of variable could be general and specific. And examples of general and specific objective with example here. This is a statement of problem or a research question, a quasi-experimental study to assess the effect of ginger on morning sickness among pregnant women in selected cities of Kerala. Now here general objective, and these objectives are broad-based objectives for the study. And it's stated like to assess the effect of ginger on morning sickness among pregnant women. But what precisely A to Z the researcher is going to do is put into specific objectives. So here you can see these this general object, this specific objective will be spelled out into the general objective will be spelled out into the specific objective as given below. To determine the prevalence of morning sickness symptoms among pregnant women, number one. Number two, it will to compare the severity of morning sickness symptoms among primigravida and multigravida. To compare the effect of ginger on morning sickness in multigravida and primigravida, or to identify a relationship of effectiveness of ginger on morning sickness symptoms with age and dietary habits of pregnant women, to compare the effectiveness of ginger on morning sickness symptoms in working and non-working pregnant women, and to determine the phytotoxic effect of the ginger. So these are specified what exactly going to do. Now you see that here action verbs: to determine, to compare, to identify, to compare, to determine. So these action verbs, so to assess here, these action verbs are used and the objective starts with to. Or sometimes you may start with action verb, assessing the effect of. So these two ways are acceptable ways. The other way of saying types of variable is primary and secondary. In biomedical research, they use primary and secondary objective. Example here is, this is a research question: efficacy and safety of rosuvastatin versus atorvastatin, a parallel group open label randomized controlled trial. In this, primary objective is to compare rosuvastatin with atorvastatin in reduction of LDL cholesterol, where researcher is also interested to look and compare the rosuvastatin with atorvastatin with other lipid modifications. So the all sample size computations and major focus remains on this. Whereas in this also can be considered as a secondary objective. However, generalization will be for primary objective because sample size estimation remains based on the primary objective. So this is how theoretically we say that types of objective could be general and specific, and type of objective could be primary and secondary. Now this was about research objectives, and this is how we state them. Now what is hypothesis? A hypothesis is a formal tentative statement of the expected relationship between two or more variables under study. Hypothesis is a tentative prediction or explanation of relationship between two or more variables, in other words. For example, a dietary compliance will be greater in diabetic patients receiving diet instructions in small group than diabetic patients receiving individualized diet instructions. So this is one example of hypothesis where there's a prediction or tentative prediction or explanation of relationship of two or more variables. Now, why hypothesis is required? Hypothesis enables the researcher to objectively investigate new areas of discovery. Hypothesis provides a study with focus and guidance that guide the researcher about specific aspects of the research problem to investigate. Hypothesis also provides the insight to the researcher about what data to collect and what not to collect, and thereby providing focus to the study. So you can say that objective and hypothesis serve a common purpose of focusing the research path. It also provides the directions to conduct research and provide clear and specific goals to the researcher. Hypothesis also serves the framework of drawing conclusion for the research study. We have seen
Sir, there is some issue in the internet.
can you see me and can you see my slides and can hear me?
No, sir.
Yes, sir. Now we can see you and hear you.
Okay. I
But
will say,
slides are not visible. No? Slides
I will
are
say that.
Slides are not visible. Yes.
Can you see now?
Yes, sir. Yes, sir. Now it's came.
Yes, sir.
Okay. My sincere apologies for technical glitch. So I was saying that the sources of hypothesis could be theoretical and conceptual frameworks. We can take prepositions from these conceptual frameworks or theories which we have in our head. The hypothesis also could be from incidental findings which have been reported in previous research. Or we may have some real life experiences where we have seen some magic thing happening by some intervention and we try to see whether really it is working well. And in academic literature, something has been written in ancient literature and we see that, oh, this was working in past, let us try if it is working now. Like I would like to state an example. I was reading an old Ayurveda literature where I found that the cinnamon, the Ceylon cinnamon, was found to be very effective in treating diabetes by Ayurveda treatment in past. Whereas in present medical system, we do not use cinnamon, where we conducted a parallel group randomized control trial and we found this substance very effective. And how we may commercialize this in coming future. So this is how the old traditional literature also can offer sometimes a hypothesis which you can try to test. Now, what are the types of hypothesis? This is for theoretical purpose. Simple and complex hypothesis. Simple hypothesis is always preferred in studies because they are easy to test. Primarily, they reflect on relationship of two variables. Example here is lower the level of hemoglobin, higher the risk of infection among postpartum women. Because this is good for beginners or initial novice researchers because they require a simple inferential statistical test. Whereas complex hypothesis is the statement which reflects relationship of two or more variables. Here you require complex inferential statistics. For example, here for such hypothesis, the satisfaction is higher among patients who are older and dwelling in rural area than those who are younger and dwelling in urban area. So here you will be requiring the multi logistic regression rather than a linear regression or maybe other inferential statistical test. So logistic regression of higher standards will be required or MANOVA will be required or maybe ANOVA will be required. So preference at initial level is simple hypothesis, but later stages when we become expert, we can use complex hypothesis for our research. Theoretically, research hypothesis also could be classified as associative or causal. Associative hypothesis reflects on relationship of variable that occurs or exists in natural setting without manipulation. And these associative hypotheses, which we use in cohort and case control studies or epidemiological studies, like lower the cost of care, higher the satisfaction among patients. Causal hypothesis is actually looking for causality or cause and effect relationship between two or more dependent and independent variable in experimental setting or investigative setting. Example here is prevalence of pin site infection is lower in patients who receive pin site care with hydrogen peroxide compared to the patient who receive pin site with povidone iodine. So here, these category of hypotheses which we use in experimental studies. Directional and non-directional hypothesis. Directional hypothesis which we use in experimental studies or maybe predictive case control and cohort studies. Whereas if we have descriptive studies or cross-section studies or explorative studies, we are not aware about it. So we use non-directional hypothesis. Directional hypothesis, for example, here there is a positive relationship between years of nursing experience and job satisfaction of nurses. Whereas non-directional, there is a relationship between years of experience and job satisfaction among nurses. Now, we also can use this into experimental studies where we are not sure whether the effect of this drug is one-dimensional, whether it is going to reduce the BP or may increase the BP. We are not sure. So that we are in position to use the two-tailed test, we can use a non-directional hypothesis. So statistics is also governed by what type of hypothesis we are using. Null hypothesis and research hypothesis, you might have commonly heard these terms. Null hypothesis means there's no relationship. This is also called a statistical hypothesis. And for example, here is there is no relationship between smoking and incidence of coronary artery disease. And in research hypothesis, we say that there's a relationship between smoking and incidence of coronary. Always there's a confusion whether to state null hypothesis, whether to state research hypothesis, or whether to state both. In thesis, we have seen researchers have stated both. Researchers have used null hypothesis. Researchers have used research hypothesis. And there's a lot of, controversy when we have a debate about it. Statistician says that there must be null hypothesis because you cannot be biased about something and do a research. You have to be very a neutral mind and then go ahead. Whereas the some of the group of biomedical scientists say that we know that this is in through primary or pilot or the basic understanding of either anecdotes or pilot study that this is going to have a one-directional effect, then why can't we have a research hypothesis? Because we are aware that this is going to have effect and we are going to use the one-tailed directional tests. So why don't we have a research hypothesis? So what I say from statistical point of view, null hypothesis is always preferred in base literature, which is my observation. So I recommend to use the null hypothesis rather than research hypothesis. Which type of hypothesis? Research hypothesis could be simple, complex, directional, non-directional, associative, or causative. However, commonly recommended is directional and research hypothesis by researchers, but however, null hypothesis in statistical terms. There are components of hypothesis. When you state a hypothesis, it must be complete. There is one example here. Patients underwent angiography, receives transplant film dressing, have fewer bleeding complications compared to patients who receive pressure dressing. So what components are there are four components. The first is transplant versus pressure dressing. In relationship, it is predicting fewer bleeding complications among patients receiving transplant film dressing compared to the patient pressure dressing. So these are two variables which showing the direction of relationship, and the participants in population are patients underwent angiography. So hypothesis must have these four components: the dependent independent variable, direction or relationship, and population. Now, what are the principles of stating hypothesis? Hypothesis should be stated in declarative statement in present tense. You see that the hypotheses are stated in a future tense. They are stated in past tense. Ideally, they should be stated in present tense in a declarative statement. For example, critically ill patient receives continuous nasogastric dressing experience favor gastrointestinal problem as compared to patients who receive bolus nasogastric feeding. Hypothesis must be stated in empirically testable form. I have used the term operational definition. Empirically testable means the variable or concept which can be measured, which can be tested. I'm giving him an example here. Nurse practitioners are better healthcare providers than physicians. In this example, hypothesis is not empirically testable because better is a value word which cannot be objectively measured. So how ideally you should state it? To make this hypothesis empirically testable, you must say nurse practitioners spend more time in teaching their clients about preventive healthcare practices than do physicians. In this term, time can be measured empirically. So always remember that they must be declarative present tense and they must have a empirical testable concepts embedded within it. It is better that one hypothesis contain only single prediction about relationship of variable because they are easy to test. Ideally, number of hypotheses should be restricted to 6 or less because more number of hypotheses lead to confusion, increased workload for data collection, analysis, and interpretation of data. There is one example of well-stated hypothesis. A well-stated hypothesis must be written in declarative, directional, alternative form, which predicts the nature of relationship between dependent and independent variable and also include the population under study. Here, two examples has been given. There is a significant positive correlation between years of experience and level of nurses' job satisfaction. Male patients have higher satisfaction with nursing care as compared to female counterparts. Now, when you have written your hypothesis, always evaluate them whether they are confined or not. So there is a 10-point criteria to evaluate. Each hypothesis clearly and precisely worded. Is hypothesis written in declarative statement? Is hypothesis written in present tense? Is the hypothesis driven from or linked to a research problem, research variables, operational definitions, and relevant theories? Does hypothesis present dependent and independent variable? Is hypothesis present population under study? Is hypothesis stated in directional research hypothesis format? Is hypothesis empirically testable? Does each hypothesis contain only single prediction about relationship of study variable? Is hypothesis stated with a level of significance for testing the hypothesis? So when you state a hypothesis, it is always better you state a 0.0 level of significance or 0.001 level of significance that adds the further value. People may not use it, but this is the ideal format of stating the hypothesis. So these are 10 criteria. If your hypothesis fits, this hypothesis is perfect, which you have formulated. Now, we also use assumptions. Where to use assumptions? We do qualitative research. We do sometimes descriptive cross-sectional studies where we have no hypothesis to say, but we have certain assumptions before we enter into research setting. So what do you mean by assumption? Assumptions are statements that are taken for granted and are considered true even though they are not been scientifically tested. In other words, we can say assumptions are declarative statements about a phenomena which are largely believed to be true even in absence of significant facts. For example, if I say God is present everywhere, none of us have seen, but still we believe. People say man is more stronger than women. I'm not sure about it, but this is a larger population believes about it. Maybe masculine characteristics, they may be stronger. But we don't have empirical data about this. If we compare hypothesis and assumptions, if we look into origin of terms, the term hypothesis is derived from a Greek word hypotheneia, meaning is to put under or to suppose. Whereas assumption is derived from a Latin term, assumptio, means taking up or adaptation. If we define hypothesis, this is tentative prediction or explanation of relations for two or more variable, whereas assumption is a principle which are accepted by large number of people by logical or reasons without a proof of verification. We test the hypothesis by statistical means and we accept or reject hypotheses. That's why I said we may use null hypotheses. And assumptions are generally not tested statistically. However, they give birth to a hypothesis once we found that data is supporting that assumption. Reasoning supported by logical reasoning may be supported by reasoning assumptions too. Scope is limited to a phenomena under study. They are assumpted and rejected by statistical methods, whereas assumptions are made by researchers about phenomena under study, which may give rise to a hypothesis and we test them gradually at later dates, or we may develop methodology, instruments, participant analysis, result study, etc. If we talk about uses, hypothesis is primarily used in experimental and correlational study, where assumptions are used in descriptive, exploratory, explanatory, correlational, qualitative research, and even maybe sometimes in experimental research when we do mixed method studies. If we talk about differences between assumption and hypothesis, assumptions are basically beliefs and ideas we hold to be true without proofs. Hypotheses are just blind predictions. Assumptions are often little or no evidence or have statistically tested research findings, whereas hypotheses have some statistical testable findings which are accepted and rejected, and they may be tested on larger population further. Assumptions are belief about variables, and hypotheses are prediction about two or more variables in their relationship. Assumptions are based on belief, and researchers attempts to discover the relationship only through the testing hypothesis driven by these assumptions. And hypotheses are prediction of relationship between variables. They are statistically tested and conclusions are drawn based on those. Assumptions are generally formulated through qualitative, descriptive, exploratory research studies and may be used for the known cause-effect studies like the descriptive studies or qualitative studies, whereas the quantitative research use the hypothesis and they try to test them. In addition, the cohort studies and case control studies also use hypotheses and they try to test them. What are the types of assumptions? We have theoretical assumptions based on the existing theories. We have prescriptive assumptions which are generally prescribed. We have assumptions based on previous research study findings. We may have warranted assumptions which are having some facts attached to it. And we have unwarranted assumptions which largely believed based on reasoning and philosophical thoughts. And we have universal assumptions which majority of people believes without much of debate about it. There are examples of assumptions. For example, people are aware of experiences that most affect their life choices. People want to assume control of their own health problems. People in underserved areas feel more underserved. Health is priority of most of the people. Health professionals view healthcare in different manner than the laypersons. So these are the few examples of assumptions. And my talk is driven from my textbook, which Madam have mentioned initially, Nursing Research and Statistics, published by Elsevier. Now it has a 4th edition, and my content is from 4th edition of this book. Thank you so much for listening me patiently. If you have questions, I'm happy to take them.
Yeah, thank you for the wonderful session, Dr. Sharma. And, we could accommodate only 500 participants, and throughout the session, all the participants stayed with us, and around 2000 are watching in YouTube, which is a good response for our course from day one. And the participants have posted several questions in Q&A session. Dr. Anjalakshi, you will be reading or shall I read it?
Yes, ma'am. I'll read, ma'am. So, Shabnam Batan, she was asked, each experimental research study, these works are included. From Shabnam, she was asked, each experimental research study, so sir was said for various of objectives. So that objective you can include or not, she's asking, ma'am.
I can read her question here. Each experimental research study, these variables are included. When I talk about variables, experimental study has dependent and independent variable, which the researcher is continuously looking forward for a relationship between these two. Whereas he tries to control extraneous variables And he also compares the socio-demographic variable or the biodemographic characteristics of population to ensure the homogeneity between the two groups. So yes, these all variables which I have said are the part of each experimental research study which you carry out.
Thank you, sir. And one more questions from
1 minute, Dr. Anjalakshi. Dr. Suresh, you are able to see the Q&A session.
Yes, I can read them answer.
So can you read and answer it?
Sure, ma'am.
Yes,
Sure,
ma'am.
ma'am. Thank you.
Yes, thank you. Yes.
Next question is asked by Thomas Mukti Saji. Yeah, Thomas Mukti Saji says that apart from objectives, we can write research questions? Ideally, your research statement which you write is a broad research question. You may dissect this and write into the subsections of research question. Yes, you can do that. But research objectives are important component of your research work. You can't avoid writing research objectives. Answer to your question is yes, you can write research question as in subsections of your broad research title and objectives together. The next question is again asked by same person. Quantitative and qualitative studies, do we need to use hypothesis in both? No. Quantitative studies, all quantitative studies even do not have hypothesis. Hypotheses are tested in experimental research. Hypothesis is mandatorily tested in cohort and case control study, and they are also tested in analytical cross-section studies. However, studies like descriptive cross-section studies, exploratory studies, qualitative studies, which do not have hypothesis to test, they generally have assumptions. But people sometimes try to relate or find associations with socio-demographic variables, and they try to formulate hypothesis in that. That is permissible. That's the answer to your question. Next is Dixit is asking a question. Volume is very low. Okay, sorry. This is not a question. This is the comment bed. I'm sorry for the technical glitch. The next, Madhusila is asking a question. How about formulation of objective and hypothesis in qualitative studies? Yes, in qualitative study also, research objectives are very important. And they are more important in qualitative study. The reason is you are going into an area which do not know much about it. So you need to focus. Otherwise, you may be lost in sea. So you have a clear focus what you're looking forward. Like you're opening a drawer. And your focus is you are looking forward for all the pen which have a red color. And you just pick up those red color pen and then look forward further about them, how they look and what is those. So it is, yes, you need to have research objectives for qualitative studies. Hypothesis for qualitative studies, answer is no. Next, Mr. Rajesh is asking a question. Unable to join. Oh, okay. This is a comment. He's saying that I made a multiple attempts and I don't know, maybe because of technical problem at his end or maybe our capacity of allowing the candidates. Meenakshi is asking its question. Do all studies need to have a compulsory null hypothesis and alternative hypothesis? I have stated there is an argument on it. Whatever policy is defined in your institute, please follow those. If they ask you alternative hypothesis, it is fine to use alternative hypothesis. If it is asked to use null hypothesis, use null hypothesis. Stating both has no meaning. So this is answer to your question. Then next is Prashant Srivastava is asking a question. If there is an example of specific objective in research, then is it possible to continue in the logical sequence? Yes, I have given you example in my presentation. There was a general objective about to assess the effectiveness of ginger on morning sickness symptoms. In specific objectives, the logical sequence is you can have, say that you first assess the prevalence of morning sickness symptoms. Then you may develop this protocol of ginger consumption, maybe in a conventional method or capsule form, and say that you are going to have this. And then you administer it. Then again, you look forward for the symptoms, the prevalence of symptoms. Then you compare. different groups. So there could be logical sequencing in specific objectives in this manner. Mr. Gautam is asking, give some examples of assumptions used in qualitative studies. My last slide mentioned examples from qualitative studies for qualitative studies only. And based on that, you enter into setting and conduct studies. Next is, again, Dixit is asking a question. While writing first chapter, we write hypothesis in future tense. Is it correct? No, you should write in present tense only, because you believe this relationship exists and you are trying to test this relationship. If it will be, then why you are considering this to be tested? So write into present sentence even in your proposal. Next question, Sarla is asking, for PhD study, whether both hypothesis and assumptions are needed, sir. It depends on your study. I again reiterate, if it is experimental study, it is cohort study, it is a case control study, it is a cross-sectional analytical study, yes, hypothesis has to be there. However, if it is a descriptive cross-sectional study, if it is an exploratory study, it is qualitative study, then hypothesis is not needed. You may have just assumptions. BB Nalal is asking a question. Is it necessary to have hypothesis for every study? Whether the cross-sectional descriptive study have hypothesis? No, it is not necessary. They may have just assumptions. Or to find out association with demographic variables, you may have few hypotheses in cross-sectional and descriptive study. Emmanuel is asking, is the aim of studies necessary? Yes, you can write a general aim. There's no harm in that. Surur Fatima is asking a question. What is the difference between kind of research and type of research? It's mentioned in our MSc Nursing syllabus. Is there any difference? Kind of research and type of research is the one and same. Komal is asking, up to researcher to make a null hypothesis or a directional hypothesis, we just have to follow what literature says. Komal, I don't know whether you're asking a question or you are making a comment here. I just assume it is a question and reply. Follow the instructions of directions and protocol guidelines of your institute. If it says null hypothesis, use null hypothesis. If it says alternative research hypothesis, use alternative research hypothesis. But these must be directional in nature to make it simple, not the complex, to make your life easy. Jana is asking a question. Give example of biomedical research where we use primary and secondary objective. In my slides, I have given one example where I have said rosuvastatin versus the atorvastatin comparison. And in that, a primary objective was to assess the effect of these two drugs on LDL. A specific objective, you can also check on triglyceride and HDL and total cholesterol. So this is the example of primary and secondary objective. Null hypothesis is good or research hypothesis? Both are good. Hypothesis for qualitative research are not required. Emmanuel, this is the answer for your second question. An anonymous attendee is asking, hypothesis can be stated for mixed method research? Yes. If you are using exploratory sequential study or explanatory sequential study, in these studies, there are one component is qualitative, another component is quantitative. So explanatory sequential study where you are doing a experimental study in first phase, and then you are trying to explain the specific surprising results which you have found through exploratory component. So in the first half, you may have a hypothesis. In second half, you may have a assumptions drawn from the results of this experimental study. Again, the Jana is asking a question. Are both hypothesis and assumptions used in a single research study? Yes, as I said, in descriptive cross-section studies, you have assumptions, and sometimes to see association with socio-demographic variables, you may use hypothesis also. Deepak Sharma is asking a question. Please tell the difference between research question and research objectives. Research question is your research title. And subsections of research question, you may dissect them in one or two or three or more. And research objectives are, as I said, that they are clearly stated directional statements in present tense, which gives a clear direction what you are going to do in your research. Pratendra Kaur is asking, in certain studies, both hypotheses and assumptions are framed. Is it correct? It depends on what type of studies you are taking. Again, I reiterate, if you are doing experimental study, cohort study, case control study, or cross-sectional analytical study, hypothesis is mandatory. If you are doing descriptive cross-section study, you may have hypothesis assumption both. But if you are doing exploratory study, qualitative research studies, you may not require hypothesis at all and just use assumptions. Again, Saji is asking question. Even though objectives are related to the statement, how many objectives minimum for doctoral thesis? It may be as less as one, or maybe as many as 5, 6. Depends on what's the spectrum of your study. If it is done on large population, maybe single objective may be enough. And if spectrum is broader, not deeper, you may have more objectives. So there is no specific number, but generally not more than 6, because that makes your life very difficult. And another anonymous attendee is asking, which hypothesis is ideal for the study? Null hypothesis or research hypothesis? I think I have already answered this question. So if you have heard, this is fine for you. Again, Emmanuel is asking a question. While writing a research protocol, hypothesis should be written in future tense or present tense. I have already answered this question, present tense. Iladi Kishore Kumar is asking a question. What type of question will ask related to hypothesis assumptions at time of PhD admission viva? This depends on panel, what type of questions they want to ask. Another anonymous attendee is asking, while writing a protocol, this is the same repetition of question, so in present tense. Sangeeta is asking a question, hypothesis can be in negative statement, only it should be in positive. It could be sometimes negative also. Swati is asking a question, what points to be keep in mind while formulating objectives for quasi-experimental studies to reduce the effect of extraneous variables, if any, present in our study. Extraneous variables cannot be controlled by objectives. Extraneous variables to be controlled if there are different methods. The one method is randomization. But in quasi-experimental study, if you are not using randomization, you try to deliberately use a homogeneous population for both the groups. And if they are not comparable, your results are always questionable. But through objectives, you cannot control extraneous variables. Anonymous attendees again asking, does the hypothesis need to be directional in all time? Preferably, it should be directional. So it gives a direction for the statistics. Again, Emmanuel is asking a question, minimum how many null hypotheses should be stated? Depends on your study. I said, ideally, it should not be more than 6 because your life will become complex if you are going to do the same. Saji is asking a question. Please give me a brief note of how efficiently we can write a statement. Please give me a brief note on how efficiently we can write a statement. I could not understand your question, but probably you are asking me about the statement of question or statement of your problem. Then a statement of your research problem must have 3 important components: the type of study, the variables, and population. These are mandatory. If it's an epidemiological study, it must have a place and time in addition. This is how you should write your statement. Sangeeta have not asked question. Thank you. Thanks. Again, anonymous attendee is asking why it is necessary to have at least 3 years of experience to take admission in PhD program. Sorry, this falls away from ambient of my scope of answering. Pratibha Soni is asking, is it compulsion to have assumptions in the study if hypotheses are not there? If these are qualitative studies and descriptive cross-sectional studies, exploratory studies, it will be nice that you have some assumptions in your mind to give a focus to your study. Otherwise, how you will be designing your tools, what components you'll be covering in your data collection, that will make your life difficult. you will not be sure what to have in tool, what not to have in tool if you will not have assumptions. That's the answer to your question, Pratibha. Again, Fatima is asking, what is the criteria for preparing a research tool? Though this is away from ambient of my presentation, but let me answer this. Criteria for preparing a research tool is based on what phenomena you are studying or what variables you are studying. What are your objectives? What is your hypothesis? Preferably, you try to identify a standardized tool. If not, then based on existing literature, experts' opinion, you frame a tool within the scope of your problem, your objectives, and your hypothesis. Assumptions are required for both qualitative and quantitative studies. I think, Emmanuel, this is the repetition of question. Quantitative studies, where they are experimental, cohort, case control, and the analytical cross-section requires hypothesis, whereas assumptions will be there for descriptive cross-section studies, exploratory studies, and qualitative studies. Saji is again asking question. Sorry, it's not belong to the topic. I wish to ask what the statement do we need to write the study area of statement. That's I've explained that when you write your statement of question or topic of research, you can keep this into mind that it should be novel, it should be innovation itself, and have the variables and population and type of study. 3 component is mandatory to write your title as per reporting guidelines, recent reporting guidelines. But if it are epidemiological studies, use the population and time framework of study. Deepak is asking why relative studies are presented before formulating hypothesis. Why relative studies are presented before formulating hypothesis? I could not understand this question. Anonymous attendee is again asking question. Are assumptions necessary for all studies? No, assumptions are not necessary for all studies. They are only for qualitative studies and descriptive cross-section and exploratory studies. Bibin Dalar is asking, kindly tell some words or verbs that can be used to state hypothesis empirically. I have already given you example. The term which you use should be measurable. Like if you say better is a term which is abstract in nature. You can't measure it. So it must be in a measurable form, which you can measure, which by an instrument or by a tool. Anonymous attendee is again asking, is it compulsory to write null research hypothesis? Follow the guidelines of institute, either null or alternative. Both are accepted. Fatima is asking, what's the best resource of finding the problem statement? There are many sources. Your own experience, you can talk to experts, you can read the latest research happening, they write the gap, can follow the other research which has been done. In the end, they give the recommendations what further research can be done. This can become a good source for you. What is the difference between hypothesis and assumptions? I think I already have well explained it. Anonymous attendee is asking about this question. Salu Bora is, how can we write a systematic review and literature review in an effective manner and timely manner? For systematic review, there is a guidelines, Prisma guidelines you can follow, and you must have access to all the databases, published and unpublished. And then there's a Cochrane guidelines, how to do a systematic review. You can follow that, you can conduct. And Revman is a free software which you can use for analysis. Cochrane also gives a risk bias assessment guidelines, which you can follow and you can carry out your systematic reviews. Again, an anonymous attendee is asking difference between hypothesis and assumption, which I've already answered. Sabnam Pradhan is saying multidimensional tool used for study, how many objectives are necessary? I have already said 6 or more will become, more than 6 will become difficult for you to handle. So preferably 5-6 objectives could be on the higher side. Anonymous attendee is asking same question again, difference between hypothesis and assumptions. What can be source of making assumptions? Assumptions could be from previous research. I've already mentioned the source in my presentation. Saji is saying great presentation. Then Matthew is asking systematic and meta-analysis can be done for PhD. Why not? But primarily preferred you do the research which is original in nature, which will make your life, which will be better to do it actually. Anonymous attendee have told you either use research or null hypothesis based on guidelines, but there is significance of using both at the same time. Both at the same time serves no purpose. Tajinder is asking what are the main criteria for formulating legitimate hypothesis. I have already given you the criteria and check them. The 10-point criteria you can remember. Sudeep Das is asking, modify the standardized tool is compulsory to take permission from? Yes. If you're modifying, ask permission from the original author. These were all questions which I've answered. Thank you so much once again for your patience hearing these questions. And I'm again grateful to CNR, all the team members of CNRS, specifically Dr. Lata, for giving me the opportunity to be here. Thank you so much.
Lata ma'am?
Yes.
Yes, ma'am. There are some 8
Yes.
candidate are
Yeah.
raising hand.
Yeah. Thank you very much, Dr. Suresh, for patiently reading and answering the questions. There are almost 68, 70 questions which are posted.
Yes, ma'am.
And this shows that there is a requirement for such forum where the students and faculty can clarify their doubts. Probably all these doubts were there in minds for a longer time. And CNRS is able to facilitate a forum for them to clarify all the doubts. And thank you very much. Some of the questions were also a learning experience for us, like what kind of doubts the students have in their mind, which can be a future classes. Also, so this is a learning experience for us where the emphasis has to be given on how to clarify the doubts of the students. Thank you very much. And we have some more time. And probably because 4 to 6 is the session. So
Yes.
can we ask the candidates to write some hypothesis in the chat box and we can comment maybe. Dr. Suresh, you can give one research problem for which they can write a hypothesis. Can we test their hypothesis writing skills? Is that all right with you?
Yes, ma'am. I will give one statement here.
Yeah, any one problem statement so that they can write hypothesis. Maybe different types of hypothesis they can write.
This is a statement of problem for
Yes.
which you can formulate few hypotheses, maybe one or more.
All participants kindly read the problem. Efficacy of M Health multimodal nursing intervention on knowledge of informal care provider of heart failure patients. A randomized control trial. This is a problem statement. Kindly everyone can write your hypothesis, post in the group.
I think the statement is not visible for the
Okay.
participants.
I have again posted mem for the participants.
I think we can
Where
write
in
it in
the-
the presentation, ma'am.
Yes, yes. Just
Wait.
write it in the presentation, no? So that it
Okay.
will be visible for everyone.
I think it's visible, ma'am.
Yes, ma'am, it is visible.
Okay.
I think it is multimodal, not multimodal. MODAL.
Okay, ma'am. It's written there. That's why I copy pasted.
Acha,
Yes, yes.
That's why.
model, no? Multimodal, no? Yes.
Model or what's it? Is it correct spelling, sir? Model or
Yes, yes, ma'am. It's multimodal, MODAL.
okay, sir. Okay.
Yes.
Thank you.
Any response?
Chart is coming. School form provided. School.
I think there are many responses posted in chat box also. So, Dr. Suresh, you can comment on what the participants have written. Hello.
Yes, ma'am. Yes, ma'am.
Yeah. In the chat box, few participants have posted. In a
Okay.
Q&A section also few have posted. Yes.
Okay, ma'am. So I can read from here. The first one says that M-Health model intervention increases their knowledge of care providers of heart failure. Now let us examine this from three important components. The first thing is whether it has four important components. The first thing is whether it mentions the dependent and independent variable. So M-Health multimodal nursing interventions is a independent variable, and knowledge of informal care providers of heart failure patients. So knowledge is independent, dependent variables. So these two variables has been mentioned. Now the second component is whether the relationship has been expressed here. So increase and decrease is the direction of relationship which has been expressed here. Now, the third thing is whether population has been written. So care providers, that is informal care providers of heart failure patients. So though I think sentence is not complete, but yes, it has been mentioned. Now, if I read it again, M-Health multimodal nursing interventions increase the knowledge of care providers of heart failure. Now, I said that there is a 10-point criteria to evaluate this. And if we evaluate whether it's a declarative statement, yes. Whether it is written into present tense, yes. And the last in the 10, I have said that it is always nice to use the level of significance, whether the 0.005 or 0.001, which is not included here. So this is the one well-stated hypothesis, but not the excellently stated hypothesis. I'll give you the example at the end, how we can excellently state it. The next person, Pratibha, is writing here, there will be a significant. So here, we have a habit of writing this into future tense. So there will be significant difference in efficacy of M-Health multimodal nursing intervention or knowledge of informal care providers of heart failure patients. So this is also, now here efficacy is a term it is better not to use this in hypothesis, because we should use here into measurable term. Like if the first person has written here increase or decrease, or the enhancement of the knowledge or not enhancement of the knowledge. So that format would have been better. Now, Anu is writing here, there is no relationship between multimodal nursing intervention and knowledge of informal care providers. This is also a one way of stating this. I don't say this is excellent, but this is also a fairly stated hypothesis. There were it is written in past tense. I don't know, Tina, why you have written in past tense. There were be significant increase in knowledge of informal care providers after the MN. So, statement is fine, but I think were have made it incorrect. Next, Vinay has written here, M-Health multimodal nursing intervention improves the knowledge of informal care providers of heart failure patients. This is also well stated. Patient or patients is fine. And now it is a null hypothesis written by the Gowda, or I don't know what's the full name. Gaver Rashid. There will be no significant association between knowledge score and selected demographic variables. Okay. Dhanya has written here alternative hypothesis format. There is a significant relationship between M-Health multimodal, not the Mukti, multimodal nursing interventions and knowledge of informal care providers of heart failure patients. Okay, this is also well stated. M-Health multimodal nursing interventions is positively related to knowledge of informal care provider Okay, this had been added a direction to this. Okay. M-Health multimodal nursing interventions are knowledgeable for informal. This is, grammatically little incorrect. Now here, Ms. Wafa is writing, there will be a significant relationship between multimodal nursing interventions. So here we have a habit of writing in future tense. I don't say it is completely incorrect, but it is better to write in present tense. Knowledge for informal care providers of heart failure patients. So otherwise it is correct. Level of significance has not been added. Care providers of heart failure patients is okay. Now here, next person here is writing multimodal nursing interventions gives positive impact on heart failure patient. No, it's actually knowledge of informal care provider. So it is incomplete. Multimodal nursing intervention is efficacious. On this efficacious word is fine. On knowledge, on improving knowledge, the word improving direction should be there. Improving knowledge of informal care providers of heart failure patients. This is fine. Dhanraj here is writing, there is no significant difference between pre-test and post-test knowledge score regarding efficacy of multimodal. You have started very well. There is no significant difference between pre and post-test knowledge of informal care providers of heart failure patient. Now, with the implementation of M-Health multimodal intervention at the level of 0.05 level of significance. This is the way it would have been better. The next person, so Mera DM is written here, the null hypothesis, there is no change of knowledge of informal care providers of heart failure patient with multimodal nursing intervention. This is again a nice attempt. Again, Sushil has written a null hypothesis, and multimodal nursing interventions cannot increase the knowledge of informal care providers. Now, cannot word is not an appropriate here. So it makes it partially incorrect. So Deep is writing there's a significant association between efficacy of, not the efficacy, you could have written multimodal interventions, not the with the knowledge actually, on the knowledge of informal care providers of heart failure in not the in 0.05 level of significance. So good attempt, but there are multiple errors. Vinitha is writing M-Health multimodal nursing interventions has no effect on knowledge of informal care providers of heart failure patients. Good attempt. Maria is writing the post-test knowledge score of informal care providers of heart failure patients after multimodal intervention is significantly higher than their pre-test. Good attempt. Karen has written null hypothesis. There is no relationship between M-Health multimodal interventions and knowledge of informal care providers. Also a good attempt. Null hypothesis by Priya. There is no relationship between M-Health multimodal nursing intervention and knowledge of informal care providers of heart failure. This is also a good attempt. There is a significant difference in level of knowledge of informal care providers of heart failure patient after multimodal nursing intervention. Jolie has written a very nice hypothesis here. There is a significant association between level of knowledge and demographic variables. This is second hypothesis he has framed. Good attempt. Sushil is again written here one alternative hypothesis. M-Health multimodal nursing intervention increases the knowledge of informal care providers of heart failure patients. Good attempt. Karen has written research hypothesis. There is a relationship between M-Health multimodal intervention and knowledge of informal care providers of heart failure. This is again a good attempt. Lijarasa is writing here, determine the M-Health multimodal intervention or knowledge of informal care providers. No, this is not the correct way of stating. This is actually objective. You try to write an objective, but that is again not correct. Chaharana is writing knowledge of informal care provider is increased after multimodal application of it. No, it's in past tense, you can't write. You are presuming it is in present tense, preferably, and then stating it. So this is not the way of writing, correct way of writing. Samantha Gabri is writing here, there is a significant relationship between the efficacy of mHealth multimodal nursing intervention and knowledge of informal care providers. It's a good attempt, but efficacy word here using in is between have made it partially incorrect. Vijaya has written the informal care providers in experimental group had more knowledge on mHealth multimodal nursing interventions than the control group. This is also a good attempt. Tender has written there will be no. Again, you have used the future tense, which is okay, but not best way of writing. No statistically significant difference between the post-test score of informal care providers of heart failure patient between control and experimental. This is a average attempt, but could be improved further. Knowledge regarding multimodal intervention. Shivasakti, this is not the correct way of writing hypothesis. Maria has written there is no significant difference in pre and post-test knowledge score of multimodal nursing interventions among informal care providers of heart failure. Good attempt. Sanjita has written there is a significance difference of pre and post-test score of multimodal nursing interventions on knowledge informal care providers of heart failure. This is also a good attempt. Klingon Matthew has written a null hypothesis. Efficacy of mHealth multimodal nursing intervention have no change on knowledge of informal care providers of heart failure patients. Okay, you could have written mHealth multimodal nursing intervention has no effect or no change on knowledge of informal care providers of heart failure patients. Would have made it very correct. Nice attempt, but efficacy word at beginning have made it partially. Intervention has positive effect on knowledge of informal. So you have tried to write into alternative form also, but again, efficacy, beginning from efficacy, have made it partially incorrect. I don't know what is this H2 you have written here. Efficacy of multimodal. Okay, second way of stating it. Modal nursing intervention have negative effect on knowledge. I don't know why you want to say negative effect, but good attempt. Dhanraj has written a H0 is a symbol for null hypothesis. Again, he's written 1. I don't know why. There is no significant difference between pre-test and post-test knowledge score among study and control. This is also a good way of writing. Good, nice. Ranjini has written a null hypothesis. There is no significant relationship between mHealth multimodal nursing intervention and knowledge of informal care providers. Good attempt. Niharika Jha is written a casual hypothesis, efficacy of mHealth multimodal nursing intervention knowledge. Now, this is not the way to write. Dr. Virendra has written null hypothesis. If heart failure patients nursing intervention on knowledge, it has no effect on efficacy of multimodal alternative hypothesis. If heart failure patients intervention on knowledge, sorry, Virendra Jain, there's some error which has happened here. Priya, a directional hypothesis, there's a positive relationship between mHealth multimodal nursing intervention and knowledge of information. Good attempt, Priya. Here, Bibin Lal has written here the mHealth multimodal nursing intervention has a positive impact on knowledge of informal care providers of heart failure patients. Good attempt. Swati Malik has written here to determine the efficacy of mHealth multimodal nursing intervention on knowledge among informal care providers of heart failure. This is also a nice attempt, but I don't know, you have tried to write an objective or hypothesis, I'm not sure. So not a good way of writing, but nice attempt. Sasikala has written a null hypothesis. There is sorry, I had a technical glitch. Now I'm back. So let me get back to Q&A. No, this is chat. Okay. So in chat box, I was reading here about Sasikala and now Vijaya. There's a significant difference in knowledge level among informal care provider and heart failure patient on AM Health. No, this is not the way. There's a significant relationship between AM Health multimodal intervention on knowledge of informal care. This is nice attempt. So there are a lot of people who have tried here. And last, Simran Sharma is writing here, there's a positive relationship between AM Health multimodal intervention, knowledge of healthcare providers. This is also a good attempt. Now, I don't say that any single way, there's any single way of writing it. All these ways are correct way of writing it. Now, how you can, as I said that the pre-test post-test difference, there's a significant impact. Sorry for technical glitch. So as I was saying that there's no single way of writing that this is the correct way or this is the wrong way. There are multiple ways in which you can write the hypothesis. I'm just writing it in one format here, that AM Health multimodal nursing interventions have no effect on knowledge of informal care providers of heart failure patient at the 0.05 level of significance. It is not mandatory that you write the level of significance, but it is nice if you write it. So this is the one way of writing the hypothesis. AM Health multimodal nursing intervention have no effect on knowledge of informal care providers of heart failure patients. So this is a null hypothesis. You can state into alternative hypothesis format by saying there will be a significant improvement in knowledge with this intervention. So AM Health multimodal nursing interventions have significant effect on improving knowledge of informal care provider. So this is the other way of.
Dr. Suresh, sorry for interfering.
Yeah.
I have to log in another meeting. So, so actually very nice that you are sparing time to evaluate the statement written by multiple participants.
Can we conclude now?
Yeah, we can conclude. Now, only
so
2 points I would like to add. Like many participants have written, some have attempted research hypothesis, some have attended null hypothesis, some have written directional hypothesis, and majority of them have written non-directional hypothesis. It is very nice. Usually the students used to ask the question whether we have to write this kind of hypothesis or a single type of hypothesis. A same hypothesis can share the characteristics. It can be a research hypothesis or null hypothesis, or it can be directional or non-directional hypothesis. It can be a simple hypothesis and complex hypothesis also. like when we have multiple variables, there can be multiple independent variables and multiple dependent variables. So simple and complex hypothesis also can be written. And there is also causative and associative hypothesis. So here many are, because this is an interventional study, it is falling into the category of causative hypothesis. Very good attempt, and we didn't ask objectives, and some of the participants have tried attempting writing objectives also, which is really good. So thank you so much, Dr. Suresh, for clarifying their doubts as well as entertaining them with exercises and evaluating individual attempts. Thank you very much. And with your permission, can I log out?
Sure, ma'am. Thank you so much, ma'am. We will end up the presentation here. I'm
Yes.
again grateful to you and your entire team for giving me opportunity to be here.
Thank you. Thank you very much.
so much.
Thank you, ma'am. Thank you so much, ma'am.